Everybody, I'm gonna go through just a quick PowerPoint to show you all some information about electrocardiograms and the importance behind them, what we use them for, and reasons why we would do them. First, we're going to start by discussing what is an electrocardiogram. An electrocardiogram is often abbreviated as ECG or EKG, and it is a test that checks how your heart is functioning by measuring the electrical activity with each heartbeat. An electrical impulse, or a wave, travels through your heart. This wave causes the muscle to squeeze and pump blood from the heart. An ECG measures and records the electrical activity that passes through the heart. A doctor can determine if the electrical activity is normal or irregular. An ECG may be recommended if you are experiencing an arrhythmia, chest pain, or palpitations. An abnormal ECG result can be a sign of a number of different heart conditions. Why are they done? The American Heart Association explains that an EKG gives two major kinds of information. By measuring time intervals on the ECG, a doctor can determine how long the electrical wave takes to pass through the heart. Finding out how long a wave takes to travel from one part of the heart to the next shows if the electrical activity is normal, slow, fast, or irregular. Second, by measuring the amount of electrical activity passing through the heart muscle, a cardiologist can determine if parts of the heart are too large or are being overworked. Some more reasons why they're done. They're done to detect abnormal heart rhythms that may have caused blood clots to form. They can detect heart problems, including a recent or ongoing heart attack, coronary artery blockage, areas of damaged heart muscle that could be from a previous heart attack, enlargement of the heart, and inflammation of the sac surrounding the heart, known as pericarditis. They can also detect heart conditions such as electrolyte imbalances and lung diseases. They can be used to monitor recovery from a heart attack, progression of heart disease, or the effectiveness of certain heart medications, or even monitor your pacemaker. And they can be used to rule out hidden heart disease in patients about to undergo surgery. The components of an EKG explained by UPM's Pinnacle are as follows. The P wave is a record of the electrical activity through the upper heart chambers, known as the atria. The QRS complex is a record of the movement of electrical impulses through the lower heart chambers, known as the ventricles. The ST segment shows when the ventricle is contracting, but no electricity is flowing through it. The ST segment usually appears as a straight, level line between the QRS complex and the T wave. And last, the T wave shows when the lower heart chambers are resting electrically and preparing for their next muscle contraction. How the test is performed. You will be asked to lie down, and the healthcare professional performing the test will clean several areas on your arms, legs, and chest. Small electrodes will be placed in those areas. It may be necessary to shave or clip some hair in the area to ensure proper adherence to the skin. The electrodes are connected to wires that are connected to a machine. You will be asked to remain still during the procedure. You could be asked to hold your breath for a few seconds. It is very important to remain still and be relaxed, as this can alter the results. The electrodes will transmit electrical signals of your heart into wavy lines, which will be printed onto a piece of paper to be interpreted by your doctor. The electrolead placement. An ECG is a non-invasive procedure that only requires placements of electrodes on the chest, arms, and legs. Poor electrode placement can result in mistaken interpretation and inaccurate results. A simple misplacement of even 20 to 25 millimeters from the correct position can create clinically significant changes on the ECG, including changes to the ST segment. The chart on the right side of the screen explains which lead goes to the specific area on the body. The leads are all numbered V1 through V6, and then RA would be your right arm, which is on the inner side of your wrist. LA is on the left inner wrist. RL is on your right inner ankle, and LL is the left inner ankle. Another type of machine similar to an ECG is known as a Holter monitor. The Holter monitor is a battery-operated portable device that measures and records your heart's activity continuously. As you can see in the picture, it's a very small machine that's connected to a couple wires that you'll have on your chest. The wires at the end have silver dollar-sized electrodes that are attached to your skin. The Holter monitor records your ECG as you go about your daily activities. You wouldn't want to wear this while you're in the shower or get the machine wet, but other than that, you wear it with all of your other activities throughout the day. The monitor has no risks, and wearing it isn't painful. You may be asked to wear a Holter monitor to see if you have a slow, fast, or irregular heartbeat, or your doctor may want to use it to see how well your medicines are working to treat the problems. If you have a pacemaker and feel dizzy, your doctor may use a Holter monitor to find out if your pacemaker is working properly. The results of wearing a Holter monitor will help you and your doctor decide if you need more tests or medicine for your heart, or if you need a pacemaker or a cardioversion procedure to restore a regular heart rhythm. After the test period, you'll return the heart monitor to the technician, and he or she will process the record of your heart activity and prepare a report for you and your doctor. Just a few factors that can influence alterations in your ECG results include obesity, pregnancy, ascites, anatomical considerations such as the size of the chest and location of the heart within the chest, movement during the test, and exercise or smoking prior to the test. You obviously don't want to do any exercise or smoke before the test because that can cause significant changes in the results. I put together a couple practice rhythms just to go over what you could see on an EKG. These are just a few of the popular ones that I see on the unit I work on, which is a medical tele unit. Here we go. Normal sinus rhythm, the best rhythm that you can have and the one we all like to see. The ECG rhythm will appear regular with a normal heart rate of 60 to 100 beats per minute. The P wave appears normal and precedes each QRS. As you can see, they're all nicely spaced out and everything looks regular and uniform. Sinus bradycardia, the ECG rhythm will appear regular with a slow heart rate, less than 60 beats per minute. The P wave and the PR interval are normal, and the QRS complex will typically be normal. It's pretty uniform here, but there's not as many beats per minute per the strip, so it's considered sinus bradycardia. Sinus tachycardia is the opposite. The ECG rhythm will appear regular with a fast heart rate greater than 100 beats per minute. The P wave is normal but may merge with the T wave at very fast rates. You can see everything is still uniform, it's just very fast. Ventricular tachycardia is when the ECG rhythm will appear regular with a heart rate that is fast, between 100 and 250 beats per minute. The P wave will be absent, and the PR interval is not measurable. The QRS complex will typically be wide with a bizarre appearance. Atrial fibrillation, the ECG rhythm will appear irregular. The heart rate is very fast, over 350 beats per minute for atrial, but the ventricular rate may be slow, normal, or fast. The P wave features are absent, erratic waves are present, the PR interval is absent, and the QRS complex will typically be normal, but may be widened if there are conduction delays. Atrial flutter. The atrial heart rate is rapid, 250 to 350 beats per minute, but ventricular rate is often slower. The ECG rhythm will appear more regular than atrial fib. P wave and PR interval will not be observable, but a sawtooth flutter wave pattern is present. The QRS complex will typically be normal. And you can definitely see in this image that there is a sawtooth pattern between each beat, and that kind of gives it away that it is atrial flutter. And then here's a brief list of my references that I used to create this PowerPoint. I hope you all enjoyed and maybe learned something today.